Welcome to a series of short videos about pulmonary hypertension. My name is Dr. Valerie McLaughlin, and I'm the director of the Pulmonary Hypertension Program at the University of Michigan. We created this series to help you learn as much as you can about your illness. We believe that being informed is key for effective communication between you and your healthcare team. We also believe that continuously monitoring your health and including lifestyle and treatment optimization strategies may help improve your quality of life over the course of your disease. In this series of videos, we will cover what pulmonary hypertension and pulmonary arterial hypertension are, how we diagnose pulmonary arterial hypertension, and what your treatment will be like. We will also have a chapter about lifestyle choices that improve quality of life for people with pulmonary arterial hypertension, and we will review ways to cope. At Michigan Medicine, our goal is to empower our patients. We encourage you to take an active role in your treatment. Here are some tips on becoming an empowered patient. Prepare for your appointments with your doctor by writing down questions to ask. During appointments, we recommend that you take notes so you can refer to them afterwards. Stay up to date on the latest treatments for pulmonary hypertension. Knowledge is power. Continuously monitor your symptoms. This will help your healthcare provider design and tweak your treatment plan for maximum benefit. Connect with others who are living with pulmonary hypertension. Include your caregivers in all key decisions. Pulmonary hypertension, or PH, is a complex disease. This broad term refers to any condition when the pressure in the blood vessels of the lungs is higher than normal. Experts divide pulmonary hypertension into 5 different groups based on their causes. These groups are defined by the World Health Organization, or WHO, and are referred to as pulmonary hypertension WHO groups. Each group is different, so it is important to learn what is causing the high blood pressure to develop a specific treatment plan. Once on appropriate therapy, people with pulmonary hypertension can live for many years. This series of screencasts focuses on only one type of pulmonary hypertension, WHO Group 1, pulmonary arterial hypertension, or PAH. PAH is a serious but very rare disease. Only about 1,000 new cases of PAH are diagnosed every year in the United States. In the last 30 years, much progress has been made in our understanding of PAH. Many FDA-approved therapies are available today, and many new drugs are in development. There is no cure for pulmonary arterial hypertension, but treatments improve symptoms and activity level. With the help of medications and lifestyle changes, patients today are able to live better and participate in their favorite activities. People of all races and ethnic backgrounds can get pulmonary hypertension. It happens at all ages, including children, but it occurs more often as people get older. Pulmonary arterial hypertension is more common among women. It may affect 2 to 4 times more women than men. People with a family history of pulmonary arterial hypertension also have a higher risk. Having certain medical conditions also increases the risk for developing pulmonary arterial hypertension. Conditions that may be associated with pulmonary arterial hypertension include connective tissue diseases, congenital heart defects, liver disease, cirrhosis, and HIV. Methamphetamine or cocaine use also increase the risk of developing PAH. Often doctors are not able to find a specific cause. Pulmonary arterial hypertension that occurs when no other disease is present is called idiopathic pulmonary arterial hypertension, or IPAH. PAH affects the small blood vessels in the lungs called arterioles. If the walls of the arterioles become thickened, the vessels narrow and restrict the blood flow in the lungs. As a result, the heart must work harder in order to pump blood through the lungs, and this leads to increased pressure in the lungs' blood vessels. Over time, this condition leads to an enlargement of the right ventricle, the lower right chamber of the heart. The extra effort may eventually cause the heart muscle to become weak. If left untreated, the increased pressure may lead to serious or life-threatening complications, such as heart failure or irregular heart rhythms called arrhythmias. The increased pressure in the blood vessels of the lungs means that your heart has to work harder to pump blood into the lungs. This can cause various symptoms such as shortness of breath. This is the most common first symptom of pulmonary hypertension. Fatigue, lightheadedness, fainting, chest pain, palpitations, and swelling or edema in the legs or ankles. PAH can be a progressive chronic disease. This slide shows what happens to the arteries in the lungs of people as PAH develops. In a healthy artery, on the left, the blood flows easily through the vessels. The artery wall has 3 layers, the adventitia, media, and intima. In the first stage of PAH, when the disease is mild, the artery walls become thick and stiff and start to limit blood flow. In moderate PAH, the artery wall becomes narrower and the blood flow is further restricted. In severe PAH, there is continued destruction of the artery walls and the blood flow is very restricted. In the next few slides, we will describe the medical tests we use to diagnose PAH. Pulmonary arterial hypertension is challenging to diagnose because its symptoms are similar to many other conditions or illnesses. Many people have pulmonary arterial hypertension for more than 2 years before they are diagnosed. For this reason, it is extremely important that the diagnosis is done by a pulmonary hypertension specialist. A pulmonary hypertension specialist is either a cardiologist, a heart doctor, or a pulmonologist, a lung doctor, who have extra training and expertise in diagnosing and treating pulmonary hypertension diseases. Your pulmonary hypertension health team will use your test results to determine the severity of your disease. This will guide their decisions as they create your specific treatment plan. Diagnosing pulmonary hypertension is a complex and extensive process. The purpose of diagnostic testing is to confirm that pulmonary hypertension exists and identify its underlying cause. This enables us to determine the type of pulmonary hypertension you have and design the appropriate treatment for you. The pulmonary hypertension specialist starts the diagnostic process with a medical history and a physical exam. They will order an electrocardiogram or ECG, a test that checks the electrical impulses of the heart, and an echocardiogram, which is an ultrasound of the heart. They will also order several diagnostic tests such as blood tests, a chest x-ray, pulmonary function tests, CT scans, and a ventilation perfusion scan. This test examines the airflow and blood flow in the lungs. Another important test is an exercise test, such as the 6-minute walk. This test measures your aerobic exercise capacity. It is also called an exercise tolerance test. During this test, you walk at your normal pace for 6 minutes while your blood pressure, pulse, and oxygen level are measured. If the results of initial tests point to pulmonary hypertension, your doctor will order a right heart catheterization, commonly referred to as a right heart cath. This is the most accurate and useful test to get a definitive diagnosis for pulmonary arterial hypertension. A right heart catheterization is the only test that directly measures the pressure inside the pulmonary arteries, and it is required to confirm a diagnosis of pulmonary hypertension. This test measures the lung blood pressure directly, as well as how much blood the heart is pumping into the lungs and body. During the test, doctors insert a catheter, a thin tube, through a large vein in the patient's groin or neck. They then pass the catheter up into the patient's heart to measure the blood pressure in the right side of the heart and lungs. Normal average pressure in the pulmonary arteries is between 11 and 20 millimeters of mercury, or mmHg, when measured by cardiac catheterization. A diagnosis of pulmonary arterial hypertension is made if the average pulmonary artery pressure is more than 20 millimeters of mercury while at rest. The right heart catheterization gives us important information that enables us to make a precise diagnosis, determine the stage of the disease, and tailor your treatment accordingly. The medical team will put the results from all of your testing together to determine what may be causing your pulmonary hypertension. This is important because if there is an underlying cause, treating it may help lessen the severity of the disease and improve your quality of life. If you have any questions about pulmonary hypertension, call your healthcare provider. If you want to learn more about pulmonary hypertension care at Michigan Medicine, call 888-287-1082.